Now let's talk about our seventh and final biomarker, which is safety biomarkers. These biomarkers measure the possibility of a toxic or adverse reaction that can develop from treatment. For chronic constipation and other gastrointestinal disorders, safety biomarkers are crucial in ensuring that treatment are helping, not harming, or not causing harm. And these safety biomarkers can provide valuable information about the potential toxic effects of treatments. By monitoring these biomarkers, healthcare providers can detect early signs of adverse reaction, adjust treatments accordingly, and ensure the most important thing, the patient's safety. Here we'll walk through three different examples on liver health, kidney health, stomach linings, and intestines. So let's begin with safety biomarkers for liver health. One of the most critical areas where safety biomarkers are used in monitoring liver health. Treatments for gastrointestinal disorders can sometimes affect the liver, making it essential to track specific biomarkers. Here we're talking about two categories. Number one, aminotransferase, ALT and AST. Two, bilirubin. ALT and AST are measured through blood test, and bilirubin also is measured through blood test. So elevated levels of ALT and AST indicate liver cell damage. ALT is more specific to liver, while AST can also indicate damage to other organs like the heart or muscles. Bilirubin, high levels of bilirubin or yellow pigment produced by the breakdown of red blood cells indicate the liver dysfunction and can lead to jaundice. So what we look for is normal levels of ALT, AST, and bilirubin that suggest the liver is functioning properly and the treatment is not causing harm. So if there is the elevated levels of ALT, AST, and bilirubin that indicate potential liver damage, it necessitated the review of treatment plan and possibly discontinuing the medication or adjusting the medication. The important note here is regularly monitoring these biomarkers is crucial for patients' long-term medication or those with pre-existing liver conditions to prevent serious complications. Now let's move on to safety biomarkers for kidney health. Obviously, another essential area for safety biomarker is kidney health. Treatments, especially for those gastrointestinal health, can sometimes impact kidney function, making it vital to monitor specific biomarkers. Two, we are talking about one, serum creatinine, two, blood urea nitrogen, BUN. Both of these are measured through blood test, and when there is elevated levels of serum creatinine, it indicates impaired kidney function or kidney damage. Creatinine is a waste product produced by muscle metabolism and excreted by the kidneys. So BUN, elevated levels indicate reduced kidney function. Urea nitrogen is a waste product formed from protein breakdown and excreted by the kidneys. So what we look for is normal levels of serum creatinine and BUN that suggests that kidney are functioning well and the treatment is not causing harm. So if we see the elevated levels, that means there is a potential kidney damage which requires the reassessment of the treatment plan. The important note is patients with chronic kidney disease or those on medications that affect kidney function should have these biomarkers monitored regularly to prevent more complication. Now let's move on to safety biomarkers for gastrointestinal tract. So safety biomarkers are also vital for monitoring gastrointestinal tract, especially when using treatments that can cause irritation or damage to the stomach lining and intestines. So we can talk about two biomarkers. One, fecal occult blood test, FOBT, and second, serum albumin. So FOBT is measured through stool samples, whereas serum albumin is measured through blood test. So if there is a positive FOBT result that indicate bleeding in the gastrointestinal tract, which could be due to ulcer, polyps, or other conditions. Remember, we talk about different colors of the blood. For example, if it's bright red, it's more in the outer section of rectum due to hemorrhoids or fissure. It's in a brown in color, maybe in the lower intestine, large intestines. If it's more darker in color or more brown in color, it's in black or black in color. So higher the bleeding is, the darker the color of blood is, and FOBT can help identify that blood and more accurately. So serum albumin low level indicates poor liver function, malnutrition, or chronic inflammation. So we want negative FOBT results and normal serum albumin levels. That suggests that gastrointestinal tract is healthy and treatment is not causing harm. And positive fecal occult blood test FOBT results and lower serum albumin levels indicate that potential gastrointestinal damage and poor nutritional status requiring further investigation and potential treatment adjustment. So the important note is regular monitoring of these biomarkers is essential for long-term medic- medication patients that can affect gastrointestinal tract to ensure early detection and prevention of complications. So these safety and risk safety biomarkers are really important that we don't have any adverse effect or adverse reaction that complicates. So our body is a machine, it's a complex machine. There is not a singular one organ impact. It's always multiple organs impact because everything is interconnected. So when you are treating for one organ or one specific condition, we have to make sure that it doesn't impact other ones or exacerbates the complications. And for that, these safety biomarkers are important. And always consult with your healthcare provider for a very personalized interpretation. And some of these tests may not be included as a standard plan. You may have to fight like an MMA fighter to get this test done. And we are going to talk about those tests in the future, in the next chapter. Test, and in test we are divided into following sequence. One is something for at home test that we can talk about, which can do for this preliminary ideas. Then the second category is the test that will be run by primary care doctor. Third category is the test that will be run by gastro specialist or gastroenterologist. And third and the fourth test that need to be run if there the root cause is not identified. As we talk about, the causes may be neurological, psychological, anatomical, physiological, and so on. And you have to get the test done. We're going to talk about those advanced level tests that need to be done in order to pinpoint the root cause. And this understanding these foundational biomarkers are super important.